Hello, this is Dr. Gay from First Look MRI, and this is a 54-year-old female with complaints of ulnar-sided wrist pain and also a palpable abnormality over the wrist, and they were worried about a ganglion cyst. And a couple things here. This is a coronal T1 image of the wrist. This is the patient's right wrist, and we do see that there's something funny over here. We'll deal with that in a second, but also we can see the triangular fiber cartilage come right across here. So this is the ulna ending here. This is the radius ending here, and usually the ulna ends a little bit proximal to the distal radius. This ends at the very same level, so we call this a mildly positive ulnar variance. And when it's positive like this, there's narrowing between the lunate bone and the ulna, and that little space is narrowed, so they're prone to get tears of the Tfcc, and this is a tear of this triangular fiber cartilage. You can see right here, this is the central disc portion, and this is torn. You can see a full thickness tear there. If we go towards the palmar side, this is the palmar band, hard to see, foggy. It looks like it's definitely partially torn. If we go to the dorsal side, this looks too foggy and ill-defined, so this is a tear of the dorsal side as well. And this is the styloid process here. And this is a styloid attachment. Looks okay there, maybe a little foggy. If we put up another view here, we can see the tear again. This is the dorsal band coming across here, and at the styloid and foveal attachment, the foveal attachment is this cupped area. Just looks a little abnormal there, some degeneration or partial tearing, and really you don't have to be too crazy about getting everything exactly right. When they go in there with the scope, it's hard to see anything. Also, they have one other thing over here in the Piezotrichtal Joint. If I put up a sagittal view, we can see there's a fluid collection coming out of that joint. It's not uncommon to have a joint effusion here. This is unusual in that it seems to come down here. A ganglion cyst could look like this definitely, or a synovial cyst coming out of that joint. But I believe this is probably just fluid that's extending down from the Piezotrichtal joint. But in this case, they're going to have to do surgery, so you just hedge and say, well, there's a fluid here. This is septated or lobulated, and this may be related to fluid prolapsing from the joint or a synovial cyst or ganglion, and it really doesn't make too much of a difference because they're going to have to do surgery here anyway. And that's it. So a case of really a lipoma over the distal ulna and a torn Tfcc, and additionally a partial tear of the scapholunate ligament.